The first thing we want to talk about when we talk about position is we just want to talk about overall position. So we want to talk about cephalic position versus breech position. So a cephalic position is when the baby's head is down in the pelvis. So you can see Jenny's putting the baby's head down, and the baby is wedged there, and that would be a cephalic position. This is called occiput posterior. As you can see, the baby's occiput is leaning on the mom's posterior, or on the mom's coccyx. This can cause back labor and interventions, nursing interventions, or back labor means back pain with each contraction, obviously, because the occiput, which sticks out, presses on the coccyx, which pushes in, and that can be very painful. Some nursing interventions to help with this are walking, turning side to side, and then getting on all fours. And when the mom gets on all fours, what that can do is it makes the baby flip around, because no baby wants to lay face first in a hammock. And when mom gets on all fours and it's an occiput posterior, that's what it's like. It's the baby is like laying face down in a hammock. So the baby usually flips around and goes into an occiput anterior. So you can see that now the occiput is on the mom's anterior position. This is the desired position. You can see where the head came down. This eliminated the back labor, and this will shorten labor. And this is the smallest diameter for the head to make it through. The head is the occiput anterior position is the most desired and will yield the shortest labor. Now, breech positioning is when the baby is not head down. The baby is can be butt first. Jenny's going to show you. This is a frank breech position where both legs are up. We can deliver babies breech, but it can pose a risk. A complete breech is where the legs are crisscrossed, and a complete breech you cannot deliver vaginally because there just is not enough room. And then lastly is a footling breech where one foot is out. Jenny, will you show them where an anterior, where the chin can get hung if you try to do a breech delivery, how it can get hung on the pubic bone? And this is one of our greatest fears, is that we get the legs out, and then the baby's mentum can get hung on the pubic bone, and that can cause hypoxia. So we greatly worry about this happening during a breech delivery. And if the baby's occiput is anterior, that's less likely to happen. See where Jenny is going to flip our baby around. If the occiput is anterior, then the mentum cannot get hung on the pubis. Yeah. Yeah, Jenny, that's a good job, dude. I had set it up so it's a little bit difficult, so it can't get hung on the pubis. So those are just our positions, cephalic and breech.